Good afternoon, everyone. Thank you for being with us here on Monday afternoon. I hope everybody had a good weekend. It was a beautiful weekend. So got outdoors a little bit, cleared out the cobwebs, improved your mental health, hopefully. So today we have a couple of things to talk about, and then of course we're going to take your questions. The first thing I want to talk about today is the special session that's going on in Jefferson City right now. I just want to say thank you to the Missouri legislators who are there now talking about additional funding for COVID relief. We know that there's still a lot of need out there, especially for a county, city like ours, which has a high level of poverty. We received $35 million of federal funding, COVID funding, via the state. We have basically spent it all. It's been allocated, it's in the process of being spent. So we really are lobbying for additional funding to come to the city to help prevent homelessness, to help folks that are already homeless, to help with child care centers, and to help rental and mortgage assistance, which is a very major part of preventing homelessness. So really just thank you to MoLeg for working on that right now, and we're hopeful that we will be able to obtain some additional funding for the people of the city of St. Louis. You know, the city of St. Louis has one of the highest poverty rates in the state at around 30%. And that compares with 10 or 12% in St. Louis County. So the need is here, and we would really appreciate some additional help. So thank you to Governor's staff for calling this special session, and to MoLeg for working on that right now. Now that rolls us into where we are right now with regard to COVID. I'll give you some numbers, and then we'll talk a little bit about what this all means. So in the city of St. Louis, yesterday we had 128 new cases, 78 the day before, 150 the day before that. Now we're looking at the cases that we receive every single day, and one of the things that we know is that the testing is coming back for virtually everybody within 3 days. So that's good news. Because the sooner you find out that you're positive, the sooner we know that, our health department knows it, the sooner we can contact trace and try to quarantine those people that had exposure to someone who was positive, so that they're not out potentially spreading COVID either. So 128 cases yesterday. That is an average of about 107 cases per day for the last 7 days. Let me tell you how that compares with 1 month ago. 1 month ago, instead of having an average of 107, we had an average of 38 new cases a day. So that shows you what's happening. The number of cases is going up. It is going up everywhere across the state of Missouri and across the country, as you know if you've turned on the news. Talk about current hospitalizations. Currently, COVID positive, 551 people are in the hospital. There are another 140 people in the hospital who are suspected of having COVID. Test results, I guess, not back at this point, for a total of just under 700 people in the hospitals. And those are the hospitals in our region, you know, the 4 major hospital systems. Compare that to 1 month ago, it was 387 compared to 691. So that's an increase of not quite double, but 304 cases, so very high increase. Number of people in the ICU has gone up a little bit. The total right now is 137 of 137 people in the ICU, and that's about the same as it's been for the last, really for quite a while, most of the last month. So the good news is these many increased people in the hospital at least are not yet in the ICU. And then 70 people on ventilators that are either COVID positive or suspected. And that 70 is up from what it was, but not substantially up from where it's been for the last few weeks. Patients admitted to the hospital yesterday, this is 2 days old. This number is probably really Friday's number. 89, 99 the day before, 97, 94. And when you look back just 1 month ago to the 10th, are we the 10th today? Yeah. We had 37 people admitted to the hospital on the 10th of October. And so 2.5 times the number of people. Fortunately, many people also being discharged from the hospital, 61 yesterday, 100, 90, 66. So a lot of people going in and out of the hospital. Now, a couple things that I want to mention here, and that is I'm working with Dr. Sam Page. We talked yesterday. You may have seen his comments this morning to look forward and see what might be coming down the road with regard to restrictions. Right now, we are both recommending just no personal gatherings beyond your household or your very close pod of people that you have been with. You know, don't go out and about when you don't need to. Don't have parties in your backyard or, you know, family room or whatever. It's really too dangerous. There's too much community spread out there. So stay in your small groups. Number one, beyond staying in your small groups, stay 6 feet apart. Wear a mask. I think it is fair to say that if we're not able to make progress in getting these number of cases and hospitalizations heading downward, that we are looking for some additional restrictions. Don't want to do it, but really I have to shoot straight with you here. We have to get these numbers heading down. We cannot continue to sustain high numbers of new cases, high numbers of new hospitalizations. And there's only one way to do it. You can't be gallivanting around. So, you know, the question is, well, what would that look like? I know everybody wants to know that. And you know, there's not a hard answer to that right now, but you've got to think about, well, what does that mean for churches? What does it mean for funerals? What does it mean for schools? What does it mean for universities? What does it mean for a hotel ballroom or a wedding or restaurants or bars or daycare centers, gyms, nail salons? We don't know the answers to that yet because we would expect that there would be some tightening of the restrictions. These businesses don't need these restrictions to be tightened because they're already having a lot of difficulty, and their employees don't want to be put out of work. So keep your pod small, stay 6 feet apart, wear your mask, wash your hands, and let's get these numbers turning down the other way. Now let me say that St. Louis City residents have done a great job, and I think for the most part, city residents are following those rules. When you look at the 7-day average of new cases in the city, this is a statistic that is per 100,000 people. So, you know, we have 300,000 people, give or take, in the city. So we're running about 35 cases per 100,000 people. St. Louis County's running close to 50 cases per 100,000 people. So this is a statistic that's based on per 100,000. St. Charles has run about 60 per 100,000. Franklin's running 50. Jefferson's running 60. So the city of St. Louis, number of new cases, knock on wood, is not as bad as it is in some of these outlying areas, but it's still here, and we know that everyone's very transient. So, we really need, of course, everyone in the region to wear a mask. And the region's big, St. Charles, Franklin, Illinois. We need everybody to be following these regulations because we're just giving it to one another. So, more on that as the week goes on and we look at these numbers. Let me see if I had anything else. No. Do you have questions, Jacob?
Quite a few questions today, Mayor. First question's from Deb today. She'd like to know, of the people you're talking about who are going into the hospitals, are some of these individuals coming from outside the city of St. Louis?
Yeah, Deb, many of them are. But that's what, hospitals, we have most of the hospitals here in this region, the good, big teaching hospitals. So if you're really sick and you live outside of the region, you're gonna come to Barnes or SSM or Mercy or St. Luke's. So yes, there are a number of folks from outside the area.
We've had a couple of questions this afternoon, Mayor, about timelines. And have you and Dr. Page settled on any amount of time that needs to go by before making additional restrictions decisions in order to get the numbers down? Like, is it a week, 2 weeks, things like that?
There's no set date at this point in time. We're watching the numbers in the entire region. We're pleading with people to follow the restrictions. We are very hopeful that we will have expanded mask mandates, but so far that has not occurred. The people of the city and St. Louis County, frankly, have done a good job. We have had a mask mandate in place forever. Almost everyone is wearing a mask. Sometimes you see places where they're not, but our health department's following up on those folks, those businesses. So we've done a good job, but we can't do it all. And honestly, our businesses should not have to bear the brunt of further restrictions because we are part of a bigger metropolitan area that doesn't have mask mandates, but we may.
Question from Chris about the status of contact tracing. There was a story in the paper over the weekend about some areas that struggled with contact tracing, some people not cooperating, some people lying. What's the current situation of how that's going in the city of St. Louis?
So, Chris, I read that article too in the paper, and Dr. Eccles, I think, summed it up pretty nicely. One is that, yes, when there's a positive case, we try to contact that person. We try to get them to pick up their phone. We try to get them to share with us, meaning the health department, share with us the people that they have been in contact with so that we can contact those people and ask them to quarantine. Some people are more cooperative than others. I mean, that's just what it really comes down to. Contact tracing, we have a really good system in place. It's called Qualtrics. And if you are positive in the city and we contact you and you give us the names of the folks that you may have been with for more than 10 or 15 minutes over the last few days, 48 hours at least since before you became positive, then we will contact you and enroll you in Qualtrics. And what that means is that twice a day you have to report in. It's all electronic. If you don't do it, we'll call you, of course. But it's electronic. You have to take your temperature. You have to answer some questions about how you're feeling in the morning and in the evening. And then if you don't do that, the red flag, goes up and you get followed up on. But it is a really good procedure that we have been using for people that are in quarantine. And people like it. People like it because it's not as invasive as having to make a phone call twice a day. But it's working pretty well. But as the number of cases get more and more and more, then your staffing is very, very difficult. And you saw that in the article where a number of the neighboring counties were just saying that, we can't keep up with the number of cases we're having. And when you look at the number of cases that are occurring in some of these outlying counties and probably the size of their health department, very tough situation for them to be in. but there's only one remedy for it. Stay apart, stay in your own little pod, your family group. Stay apart, wear a mask, wash your hands. I mean, that's it.
Question from the wedding industry, it sounds like. If your recommendation is to keep personal gatherings to your own home
Small.
unit, what does that mean for places that already have approved plans or small events scheduled or coming up?
Well, we haven't, we're not requiring, at this time, we're not requiring that those be canceled. But we are asking people to really think through that as to whether or not they want to have a big event. And certainly if you do, you've got to wear a mask and you've got to stay 6 feet apart. And I know that's really terrible and it's very, very difficult. But that's what we're asking that you do at this point in time. We're also really asking people to think about the holidays that are coming up. Thanksgiving's only, I think it's 2 weeks from Thursday. It's hard to believe it's coming up that quickly. But really rethink that large family event or your Friendsgiving. You really should rethink that and consider not doing it because this is spreading in so many ways. So,
Question from Sarah. You've talked about the possibility of additional restrictions. Can you elaborate on what is being contemplated, what else we might be putting into place?
you know, I'm not gonna, I mean, what we're considering is a further restriction on the businesses that can be open. And, you know, what actually would you be able to do? We don't want to do that. I've said that so many times. We don't want to do it. I especially don't want to do it and hurt city businesses. But we have to get better compliance, and these numbers cannot continue to go up at the rate that they have gone up for the last 30 days. It's been extreme for the last 30 days.
Question about a statewide mask mandate from a couple of folks, Mayor. Have you asked for one, and do you think it would make a difference?
Yes and yes. Absolutely. I mean, I've talked about that many times on this live with Lyda. Yeah, I wish we had a statewide mask mandate, and it isn't my decision. I have spoken with the governor about it. I wish we just had a mask mandate in the counties that are immediately surrounding us. Those elected officials get to make their own decisions on this, and I know that there's tremendous pushback from some folks on being told what to do. So we're asking you, wear a mask. In the city of St. Louis, you all know it is already we have a mask mandate. But we're asking everybody, wear a mask. Keep your groups very small, tight. Stay 6 feet apart. You know.
Follow up to the what we talked about on Friday in the eviction moratorium.
Mm-hmm.
2 parts. One, is it still in place in the county, do you know? And 2,
It is.
does it mean that they still have to go to court during the month of December if the eviction is pending, or will there be new court dates after the moratorium is over?
I can't speak to the setting of court dates. That would be something, if you're in a process, that would be something to work with your attorney on, or contact the court system for that.
Question from Nicole about contact tracing there. What's your advice if you know someone who has tested positive and hasn't quite been contacted yet by contact tracer? Should they reach out or wait for the call?
Yes, the person that has tested positive and knows they're positive should reach out to the health department.
Follow-up question about the assistance for small business, Mayor.
Mm-hmm.
Do you happen to know when applications are going to be received again and who's going to be eligible this time around?
We'll bring that to you on Wednesday. I don't know exactly when that's going to be ready to go up.
Making a note of that. Question from Becky, Mayor. Thoughts on surrounding areas that have fewer restrictions and how they're contributing to numbers in the St. Louis region for our numbers going up?
I think that's the same question we've been asking. Yes, of course, we are a transient greater regional area, and so what happens in an adjacent county, of course, affects us, and vice versa. So,
That's it for new questions today, Mayor.
that's it for questions. We're already done. All right. Well, thank you all. Appreciate it. Thanks for your help. Thanks to all the good people of St. Louis who are really doing their part to keep our numbers lower than some of the other counties. And but we're affected by it, and so thank you all. Appreciate it.